We're going to be doing a central line dressing change today on a pediatric patient. I have verified my hospital's policy and procedure manual and am comfortable doing the procedure. I have gathered all the supplies I will need, which includes a dressing change tray, 3 pre-filled normal saline syringes, 3 new injection caps, a new biopatch, alcohol wipes, and a mask for my patient here, as well as a pain rating scale appropriate for this patient's age. Before I get started, my patient is 23 kilograms. So at that weight, I will be injecting the full 10 milliliters in each of the lines of his triple lumen central catheter. So I don't need to discard any saline for him. Hygiene. Hi, Matthew. I'm Brian Oxhorn. I'm a registered nurse here at Roseman University Health Sciences. How are you today? Doing all right? All right. Well, I'm going to be your nurse today. And what I'm here to do right now is, you had that new central line placed yesterday. I'm going to be changing the bandage they put on there and put a nice clean one on. Okay, so I'll tell you a little bit more about that in just a second here. But first, before I get started, I need to make sure I have the right patient. So can you tell me your full name? Matthew Taylor. Taylor, good. And Matt, what's your date of birth? April 20th, 2007? Excellent. April 20th, 2007. All right, so you're 8 years old. Birthday recently. Mom, is that correct on that stuff? Good. And Matt, do you have any allergies to any medications or anything? You're not sure? Okay. Mom, does he have any allergies to any medications or latex, tape, soaps or anything? No? Okay. Excellent. No allergies. Okay. So Matt, basically, what I'm going to do here, I'm going to start by raising your bed up so I don't have to lean over so much. I'm going to provide for privacy while we're doing this. So like I said here, you have this line placed yesterday. So I'm just going to be taking this old bandage off. I'm going to clean the area with some cool antiseptic solution, and we're going to replace it with a nice clean bandage. When I'm done with that, I'm going to flush each one of these lines out here with some normal saline. It's basically a sterile water solution there, so we make sure the lines stay clear and clean. You won't feel any discomfort. You shouldn't anyway. However, if you do, please let me know, and I'll stop for a little bit. You and I are both going to be wearing a mask to cover our nose and our mouth so we don't breathe on the area. We don't want that to get infected, to get any germs on there. The other thing I'm going to ask you to do is, while I'm cleaning this area, I'm going to have you keep your head turned over there towards Mom. Okay? Again, that's just to help keep from germs getting on that area. Okay? Any questions about that? No? Matt, I need to know if you're having any pain right now. I've got this pain rating scale. The face is there. So I know you're a big boy. You could probably tell me a 0 to 10 scale, but just go ahead and point to whichever face kind of indicates how you're feeling right now. Kind of maybe a little bit sad there, maybe a 3. Okay. All right. Well, we'll see if we can take care of that when we're done here. Pull my stuff over here. And I have assessed my patient for needing additional assistance to help keep him safe during the procedure. And I think he's old enough that he'll stay still, that both me and Mom will be able to take care of it just fine. So I don't need any further assistance. Lower my side rail all the way down here. Put my cart up here at the top. So hand hygiene again. Grab some non-sterile gloves. These things over here for now. Yeah, I'm going to go ahead and put this on your face now, and then I'll get mine out, and we'll both be wearing one. You've got a cool one, though. It's got little smiley faces all over it. Okay? Just keep your head turned a little bit there towards Mom. Now I'm going to open my tray. Be careful not to contaminate what's inside. I'm just going to grab my mask. First thing I'm going to do here is put on some gloves. I'm just going to take that old bandage off there. down. Don't pull on it, as well as holding the skin down in some of the areas there. Okay, my bio patch came on with it there. Try not to touch the side there, get too close to it. There we go. Normally I would just discard this whole thing. We need to reuse this bio patch, so actually I'm just going to set it aside right now and we'll deal with it later. Okay, so I'm going to take my gloves off. Some hygiene again. Over here. Take the gloves out that came with the kit. Field. Careful not to reach out over the open box there. Lay that down, like so. Open my package of injection caps. Put them on there without dumping them somewhere. This will get thrown in the garbage. Same thing with my bio patch in the packaging. Same thing, try to get that up. There we go. And I can leave all the rest of the supplies in my box there. Don my sterile gloves at this time. Keep my hand above my waist, no level of the sterile field there. Just that a second. Okay, I'm going to reset the moment and get new sterile gloves because these just tore. These are my new sterile gloves. Okay, so these reset the moment, got new gloves, and here we are. Okay, the first thing I'm going to do is reach in here, grab my ChloraPrep device. I'm going to squeeze the wings and let the sponge get saturated with the solution. I'm going to start in the middle, scrubbing back and forth, gently yet firmly for 30 seconds, right over the insertion point, without moving away. Just stay right over that side there, scrubbing back and forth, different directions. Okay, after 30 seconds, I'm going to start moving out away from that area, being careful not to go back to the very center. And again, just scrubbing back and forth, around and around the insertion site. Being careful not to go back to the very center. I'm going to do this for another 30 seconds. By the time I'm done here, I'm going to be about 2 inches out from the insertion site. Being careful not to touch that gauze there on his trach dressing. Now this gets just. I'm going to assessing my insertion site. I don't see any redness, swelling, drainage, or bleeding, anything like that, so it looks good. At this point, I can take my BioPatch, separate the corners there a little bit. Ideally, I want to get this underneath here so that it wraps around, but I think the surgeon put this too tight to the skin, so I'm just going to have to wedge it along each side of that central line hub. Be careful not to touch the skin of the patient. I'm doing my best to get that as close to that as possible. Reach back in here, grab my Tegaderm dressing, and just try to center it over this area here as best I can. Push it lightly under the skin. Peeling the white outer ring. Okay. Matthew, we're all done with the sterile part. Just going to finish this up here and flush these lines, but you did real good. I'd write my initials, date and time on the label here. Place this dressing there without covering the site. Okay, very good job. So at this point I'm going to clamp all 3 of these lines here. Like so. And one at a time here, I'm going to grab an injection cap. I'm going to remove the old one, discard it, apply the new one, make sure it's secure. And I'm going to unclamp it at this time so I know that that's one that I just replaced. Reach in, grab another one. Normally these are discarded in the trash, usually biohazard. And our third one here. Unclamp that so I know I'm all done. Okay. Now at this point I can go ahead and flush these lines. Again, one at a time. Scrub the hub for 15 seconds. Matthew, you did great. We're almost done here. Okay. I do want to get the air out of here. I'm going to aspirate, looking for any blood return, making sure the line is patent. And then I'm just going to slowly inject using a pulse method. Push stop method. Making sure I stop before that bubble goes back in there from aspirating. Okay? And I leave the lines unclamped. These normally would keep discarded. Repeat that. The other 2 ports. Again, another 15 seconds. Get the bubbles out of that one. Again, aspirating, looking for blood return, ensuring the lines are patent. And again, a push stop method. Being careful to stop before that last little bubble gets in there. Discard that. Last line. 15 seconds. Spreading, looking for blood return. Assessing for line patency. And the push stop method, once again. I'll leave the lines unclamped. Discard of all my supplies. Normally all this stuff would be garbage. All right, Matthew, we're good. We're all done. Let me take your mask off for you. Take one off. Did a good job there. Any discomfort? Did that hurt all? No? Didn't feel the thing, did you? Yeah. You did real good, bud. Let me just put this back under your shirt for you. Hurry up. All right. I'm going to lower the bed all the way to its lowest setting. I'm verifying that the brakes are locked. Side rails are up. You remember, Matt, here's the little call light there, so push this button and I'll come running if you need anything. You want to sit up or keep laying down? Laying down? Okay, excellent. Okay, thank you for your cooperation. You did an excellent job and everything looks really good. All right, thank you. Okay.